This was a really lovely question. How has psychiatry shaped you, Dr. Sill? I'm interested in pursuing psychiatry, but I kinda get overwhelmed in the thought of working around mental illness all the time to the point it might consume me. Is this another myth? I love psychiatry, but it's kinda chaotic as well. Oh, how does working in psychiatry change someone? Whew, a lot. It does. It's not just a job. You know, it is a vocation. It does involve you in a personal level, and it does affect you profoundly. So there's kind of three ways. I was just reflecting as I made my coffee this morning. Three ways that came to mind on how this role has affected me personally. And I like things that come in threes. I'm a simple guy. The first is that it has taught me a lot about myself through meeting and talking and learning about other people's lives, how they live, what's happened to them. You do actually end up learning a lot about yourself. That's the first way. The second way, and we're going to expand on this. The second way is you unlearn about others. So you learn a lot more about yourself and you unlearn what you kind of thought about others, in the sense that it's all more complicated than it seems. And a lot of your um, presumptions and speculations are often wrong. And you operate in this realm of uncertainty, which requires a very high level of maturity and sophistication in risk management and things like that. So we're operating in a lot of uncertainty. That's the second thing. And I think the third thing is kind of um, unromanticizing life. Amazing, appreciate what you got, all these kind of things. Truth to them, of course, but there are just some really rough, difficult lives characterized by a lot of loss, and 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 I do think that often we can improve the quality of people's lives, but life can be very hard. And I think maybe as a young, in my early 20s, I romanticized my views a bit, and now I've probably through working in this field developed a different view, which we'll talk about more as it comes. Now, before we get into it, as always, just remember my name's Sil. I'm a junior doctor from Australia. I'm making these videos in my personal capacity. So, although I work in the psychiatry field and training to become a psychiatrist, this is not representing any college or workplace. Engaging in this content is not patient doctor relationship. It doesn't establish one of those, but it is wonderful. And I do enjoy, obviously, reading your comments and making videos about them. None of the things I talk about are constituted as medical advice, but general educational purposes. I kind of butchered that disclaimer, but you can read more about it in the description if you want the proper wording. Anyway, let's get into it. All right, effect numero uno. I guess learning about the self. Is that how you spell self? That's not very clean, is it? Oh, I'm giving doctors a bad name. Self. There you go. So, um, I think kind of in the nature of that question, there was a bit of commentary around being surrounded by mental illness and how it affects you. I think as you learn, as you get exposed to it, it will affect you. And you will find out why person A had an effect on you more than person B, and how you feel after, if you see three people with depression in a row, um, over the course of 3 or 4 hours, you will see how that affects you. You will see your sensitivity to different mental illnesses, and um, yeah, sorry to say, it does affect you. If you're giving yourself in your role, there are some psychiatrists who have an incredible ability to maintain a very clean boundary and barrier, and I guess not get affected as much. But I do think if you are a naturally social individual, and you connect with your patients and you give a bit of yourself in your reviews, which I think is very helpful to an extent. The management of boundaries is a totally different video, but an interesting one. But I think if you give a little bit of yourself in your reviews, you can form rapport and connection that way, then that does tend to help. And you learn about yourself in the sense that when you're seeing someone, you will find certain anxieties come up. So for me, for example, maybe it's best that I talk about it personally. lens, talk about it from a personal lens. Um, I found I was really struggling in silences, you know, leaving enough silence. And, uh, it came up that actually I'm the youngest sibling. I had a kind of personality structure where I got a lot of my self-esteem from how others viewed me. And I always had this drive to get others' approval, and and that's how I built my self-esteem. So I learned about these vulnerabilities of mine because that's okay to an extent, but you want to manage that carefully in this area of work. And now I'm uh, through being observed by psychiatrists when I do reviews, and through my own reflections, and when I do it eventually, therapy as well will be a helpful contributor to learning about myself. Through doing this, then you learn how to manage these vulnerabilities. So now I'm really good with silence, and I think silence is an incredibly good tool in psychiatry because it's often it's awkward, but often in silence comes up the thing that other people haven't captured. So I've got countless examples in my mind of people saying, um, this patient's stable and just introverted and withdrawn and quiet, um, but in the silence, then comes the symptoms that no one, well, that haven't been captured yet, that people hadn't really registered. So they might be experiencing auditory hallucinations of them telling them to be quiet, or having these kind of very vivid internal experiences that are psychotic in nature, and people haven't been able to capture. So silence is a wonderful tool. The other thing that silence does is it allows patients an opportunity to self-regulate. But the point is, silence is useful, and I wasn't very good at it. But learning about myself through this role has helped me learn how to kind of get better at it. And some psychiatrists argue that you should just be quiet for the first 10 minutes, like just sit in silence. Just say, is there anything you want to talk about today? And then just sit in that silence and tolerate all the awkward gazes, and I've never been able to last 10 minutes in awkward silence. I'm not that good, but I've done better than I was. So yeah, learning about myself, my vulnerabilities, and and it helps me relate to others, including friends. Like you can bring the tools you learn in work to your friendships, and sit in longer silences. Although I do find that if I have if it's family or friends, I tend to be far more opinionated. Whereas with a patient, it's not, I just remain quite neutral. But with a friend or family member, I'm like, no, do this. So yeah, still lots to work on, and that's okay. But, and it can be painful learning about yourself, right? A lot of kind of things from childhood can come up for some people, um, and so you do it at your own pace. You do it slowly. It's a long training program, and I'm talking about psychiatry here, but it's true for any field in mental health. So working in as a nurse or a social worker or an occupational therapist or exercise physiologist, whatever it is, your interactions will bring up things in you, and through reflections and working with a therapist, you can learn about why that came up. Why did this person with social anxiety frustrate me so much, and this person with treatment resistant depression didn't affect me? These are reflections you can make. All right, now for effect number 2. Effect. Oh my gosh, my handwriting is so bad today. Please don't judge me. This is why we type now. Although there are still exams in the psychiatry training program that are handwritten. We got to change that. But anyway, that's beyond the scope of this video. Effect number 2 is unlearning about others. Unlearning about others. Wow, I used to be really interested in emergency medicine. I really enjoyed it. The night shifts are what killed me, and how sensitive I am to maintaining structure, daily rhythm, sleep patterns, routine. That's the word I'm looking for. So I didn't last in emergency medicine, but I loved the certainty and like not certainty. I love the algorithmic thinking. So if this, then that kind of approach. And there was a lot of certainty in that kind of thinking, which which I liked, and very satisfying to get quick results to interventions you would make. Like you in a matter of seconds, if someone's in respiratory failure because of an asthma attack, if you had initiated a certain set of medicines and nebulizers, then you could see that person go from thinking they're going to die, looking blue and pale and deathly, to being pink and grateful. And, it's just things changing in a matter of minutes. And they're so grateful and happy to be alive. And they thought they were going to die. And um, I'm just noticing that I'm focusing on the gratitude element because that's something you don't often get in psychiatry. It's a noble profession, psychiatry, because it's quite thankless a lot of the time, and you're acting on other people's autonomy, which can sound paternalizing, but we try to do it with beneficence. So we're trying to do what's best for others, even if they don't see it that way. And we only do that for people who have had high risk histories. Of course, we respect everyone's autonomy as the main thing till their risk profile is such that they lose the right to their autonomy, I guess, is one way to think about it. Anywho, yeah, unlearning about others. Yeah, so I loved the certainty of emergency medicine, and coming to psychiatry. My gosh, it's all uncertainty now. It's all uncertainty management. So you can do 40 hours with psychotherapy with another person, and at the end of it, still not have a fundamental understanding of, why this person does what they do in terms of their behaviors. So, the brain is very complicated. The only tool we have to access what people's thoughts are is speech and behavior. And those are very suboptimal tools. So it's a field full of uncertainty, and tolerating that was very hard for me. But it feels like a kind of um, step up in maturity to kind of tolerate that, because the reality is the world is full of uncertainty, and it's how you manage uncertainty that makes you a good or a bad psychiatrist, essentially. Um, so it's very satisfying to kind of uh, demonize. I don't know. I'm just thinking this work has made me incredibly, well, much more empathetic to people who do behaviors that don't elicit empathy. So violence to others, um, or maybe self-harming, and these things can generate a sense of frustration in the general public. But for me, I just recognize that it deep down, it kind of isn't anyone's fault. This is probably a bit controversial, but I don't think anything is really anyone's fault. I mean, what we do is a result of our genetics and environment that generate our kind of brains and prefrontal cortexes and ways that we make decisions and personality structures. And we don't choose where we're born or what family we're born into, and we don't really get to control our early environment. So all the factors that initiate what we choose, what we do, aren't really under our control. Okay, not all, most. And so we should kind of approach that with a lot of empathy. I totally recognize that some people need to be removed from society, that there is a role for kind of jails. Maybe it can change in how it's administered, but um, with a more rehab focused. But I'm not saying, I'm just saying I don't blame people individually, but I still recognize that with the risk profiles, you need to do different things. But yeah, like you don't choose your family or where you're born, and those are the two kind of major contributors to your personality later on. Um, so I think, yeah, I've lost a lot of the certainty in blaming others if they do something wrong, and I feel more empathetic towards others, and manage it. Yeah, I think you have to unlearn your preconceptions. All right, now for effect number 3, unromanticizing life. Is that how you spell romanticizing, with a C? I'm going to have to check that after. Don't judge me. Also, I'm using an entire new tech setup here, okay? So I'm very distracted because it's all new. I can't really, I can actually show you. Look. Uh, Oh, look, why did I add this? I just think if you talked to me when I was 21, I would have told you how um, awesome life is and how uh, beautiful everything is, and um, maybe how easy life is. Like it's not that hard or something like that. I don't know. I just have developed the sense through talking to so many people who have had social disadvantage, adverse childhood experiences to the most horrendous extent, and um, people who want to end their lives, people who want to end the lives of others, you know, and people in the depths of the most severe mental illnesses. You realize how difficult life is for a lot of the population. Like it's really tough, and so that just kind of changes how I think about the world. I do find life very beautiful, and consciousness is a very delicate thing, and I think through seeing how much misery there, well, through seeing a lot of misery, it can give a certain flavor of appreciation that's more profound than the kind of superficial, everything's sweet vibe that I had in my early 20s, um, to now recognizing the fragility of of life. And, I do find myself sometimes I'll just look at a leaf and feel very moved, or hear a very simple song and feel very moved. My gosh, what happened to me 2 nights ago? I watched episode 3 of The Last of Us, and it was all about having a very beautiful end of life, and I was just so much emotion came up for me. Um, and yeah, life's not all what is it? Life's not all sunshine and daffodils. And that's okay. Yeah, life's hard. And I think through being more vulnerable about that and being um, more open in a sensitive way, people can form deeper connections. And it's often through vulnerability that we help social connections. And really, it's the social connections that drive 99.9% of us to survive through the losses that we incur. I don't know. I haven't experienced much personal loss in my life. I ain't seen nothing yet. So, part of me is kind of dreading that, but that's okay. We'll get through things as they come. All right, well, that's my big rant for the morning. I've actually got to go to Sydney now, so I better get cracking. If you work in the mental health field, I'm curious to know how it affects you. I guess a final point to say around how mental health has affected me is to say that I'm really happy with how I've developed. I have a pretty I'm building my sense of self-esteem, but it's feeling strong and more robust, and um, I find it's given me a deeper appreciation of life, and um, and I wouldn't, I'm really happy with my career choice so far. So I strongly encourage, if anyone's interested in it, even if they've got their own tricky past, that it can be managed, and you know, through working with therapists, through working with your supervisor, maybe go through going part-time and doing multiple different kinds of roles. People with, mental illness can work in the field of mental illness for sure. So I would just make that point. But I'm curious to know if you guys had any reflections in your work as well. So if you work in mental health or, um, uh, you know, in the healthcare space, what are your reflections on how working in mental health has affected you? Very keen to hear your reflections. But other than that, I wish you all just a beautiful day, and I'll leave it there for this video, and I'll see you guys all in the next one. All right? Okay. Bye for now.